Okay, so today we're going over a patient with cervical disc herniation. First, we're going to talk about the components that are involved in disc herniation. You've got the nucleus pulposus, annular fibers and Sharpie's fibers of the cervical disc, and as it is between the vertebral bodies, it could also involve the uncovertebral joint since we're in the cervical spine, and it will also involve the spinal nerve roots up until and as they exit the IVF of the segment. So the normal presentation for someone with a cervical disc herniation is neck and arm pain. Could be shooting or numbness, and they'll have a deep ache in their neck. They may also find relief through putting their hand on their head, which is also known as Bacody's sign. Yeah, go ahead, pat your head a few times. Oh, yeah, just like that.
Yep. I can chew gum too at the same time.
And the way that a disc herniation happens is trauma that could be complicated through poor posture or just degeneration from age. Happens in the joint, resulting in a thinning of those fibers, tearing of those fibers, allowing the nucleus pulposus to protrude back into the spinal canal. And that protrusion into the spinal canal can push up against and irritate the spinal nerves as they exit the spinal cord and go into the IVF.
Basically just describe my senior year of high school.
The special imaging for X-ray for cervical disc herniation is generally X-ray. You can look to see if IVFs have been are stenosed due to a thinning of that disc joint space, and if it remains unresponsive, you could get an MRI. Normal tests that you would do. The primary test for a cervical disc herniation is Jackson compression. The way you do this is you get the person to laterally flex just a bit, and you push down straight on their head while laterally flexing one side, and go to the other and have them laterally and push down as the laterally flexing to the other. Other tests you could do with this are shoulder depression, cervical distraction, or Sperling's.
I am your canvas. You are the artist.
And the way I would treat this person is by adjusting below or above the joint. There's actually recent literature that has come out that says it could also be treated potentially by adjusting at the level of the herniation. So that's your cervical disc herniation in, yeah, you can wrap that up.